Hi, this is Katie Postupaka. This is my rounds presentation for 606 Management 1. So, baby Sadie is a 90-day-old infant born October 18th at 24 and 4/7 weeks. She is now corrected to 37 and 3/7. Her dosing weight this week is 2.6 kilos. For her fluids, she receives full enteral feeds now, ordered at 150 mLs per kilo per day, either PO or gavage feeds, and the feeds are either breast milk fortified 1 to 25 or Similac Special Care 24 kcal. In the past 24 hours, Miss Sadie's been a champ and has taken 140 mLs per kilo by mouth, mostly of straight formula. I know parents come in, mom brings breast milk when she's able to, but for the past day or so, it's been mostly formula. She is voiding and stooling with a recorded output of 3.5 mLs per kilo per hour. And for her plan of care today, I would like to recommend advancing her to an ad-lib feeder, just making sure she eats every 3 hours, kind of see how she does. Regarding the formula, I would like to keep her on the higher calorie count and also continue fortifying the breast milk just to, again, see how she does with growth as a demand feeder versus a scheduled volume feeder. For her labs, her last BMP was drawn on 113. Her electrolytes were all within normal limits, except her potassium was slightly low, or not slightly low, but it had decreased to 3.9, which brings me to her BPD. So for her BPD, she is on chronic diuretics now at 20 milligrams per kilo twice daily of chlorothiazide and 1 milligram per kilo twice daily of spironolactone. So those were dose adjusted on Monday, but however, considering that her potassium is still on the lower side, I would like to increase her spironolactone to 2 milligrams per kilo twice daily and recheck a BMP in a week. So that would be on January 20th. Regarding her oxygenation, she was weaned to 1 liter nasal cannula on January 5th and has been requiring 25 to 30% oxygen in the past 24 hours. For today, I would like to keep her on 1 liter, see how she does, try and wean her oxygen, and in hopes of her going home without having to be on a cannula. She also has a small PDA still. Her last echo was done on January 7th. I know we've been able to hear murmurs in the past, but on my assessment today, I was not able to hear one. So we'll just have to do another echo again in a month just to see how that looks. For her apnea prematurity, she has a history of events throughout her stay here, but last recorded one was on January 11th. It was charted as bradycardic, lasting 5 to 10 seconds, maybe some mild stim. She has been off caffeine since 34 weeks, and her events are becoming more increasingly spaced out. For her anemia prematurity, she's received previous transfusions of PRBCs. Her last one was on December 29th. Her last hematocrit that was drawn was on January 13th and was 49.9. At this point, I recommend rechecking her hematocrit in 2 weeks. For her retinopathy of prematurity, she is now stage 1, zone 2, which is a change from last week. She was previously stage 0, zone 2. So our ophthalmologist will now be seeing her weekly with her next scheduled eye exam for tomorrow morning. And then lastly, on her problem list, she does have a pretty mild, moderate diaper rash. Wound has been consulted for treatment, and as of right now, nursing is applying Dexatin and stoma powder with diaper changes. So the only changes I have for today are to change her to an ad-lib feeder and kind of see how she does, and then increase her spironolactone. We'll do a BMP in 1 week, and then a hematocrit in 2 weeks. And then as far as parents were last updated yesterday. I will call them today to make sure that they're aware of her changes and see if they have any questions at this time. Thanks.